Beetroot is often praised as a miracle food. A deep red root packed with nutrients, it's been glorified by health enthusiasts, nutritionists, and wellness influencers for its seemingly magical effects on the heart, brain, and energy levels. But before you rush to toss a few beets into your blender or load your grocery cart with beetroot juice, stop and listen carefully, especially if you're over the age of 60. Despite its healthy image, beetroot is not without its dark side. That bright red color you see isn't just striking on your plate. It can also signal potential complications in your body. And while it's true that beetroot is rich in beneficial compounds like folate, iron, potassium, and dietary fiber, consuming it without caution can trigger unintended consequences, some of which are far more serious than you might expect. In my years working closely with seniors and monitoring dietary trends among aging populations, I've seen how even the healthiest foods can become silent threats when not properly understood. What's considered superfood for one group can be a hidden hazard for another. In this article, I'm pulling back the curtain on beetroot and exposing 7 important side effects you must consider before including it in your diet. These aren't just rare exceptions or theoretical risks, they are realities that I've seen play out in clinics, care homes, and private consultations. Whether you're a senior looking to enhance your health or a caregiver responsible for the dietary needs of a loved one, the following insights could help prevent discomfort, distress, or even serious medical setbacks. Let's explore the full picture of beetroot's impact on older adults. 1. Discoloration of urine and stool. A misleading red flag. One of the most common reactions to beetroot consumption is also one of the most alarming for those who don't expect it. After eating beetroot or drinking beetroot juice, some individuals may notice their urine or stool turning a pink or dark red color. Medically known as beeturia, this effect is caused by the pigment betalain, which gives beetroot its vibrant color. While beeturia is typically harmless, it can cause unnecessary fear in older adults who may confuse it with internal bleeding or a urinary tract issue. In fact, one senior client of mine, a 74-year-old retired teacher, contacted emergency services after noticing blood-like discoloration in her stool, only to find out later that it was simply the aftermath of a beet-heavy salad consumed the night before. Seniors are particularly prone to such confusion because many already deal with multiple medical concerns. Any visual change, especially involving excretions, can be deeply distressing. For caregivers and older individuals alike, it's crucial to be aware of this side effect and recognize it as a benign response to beetroot rather than a health emergency. 2. Digestive disruption. When fiber becomes a foe, beetroot is high in dietary fiber, which is generally excellent for digestive health. However, for seniors with slower gastrointestinal motility or a sensitive digestive system, this fiber can create more problems than it solves. Many seniors already deal with conditions like irritable bowel syndrome, IBS diverticulitis, or age-related sluggish digestion. In such cases, beetroot's fiber content can lead to bloating, excessive gas, cramping, and even diarrhea. The fermentation of undigested fiber in the colon can exacerbate these issues, especially when large amounts are consumed too quickly. A study published in the journal Gut found that approximately 40% of adults over the age of 65 report frequent gastrointestinal symptoms. These issues are often underdiagnosed, yet they dramatically affect quality of life. In one care facility, I consulted with an 82-year-old resident, began experiencing persistent bloating and mild nausea shortly after switching to a new health-focused meal plan. Upon reviewing her intake, we discovered that raw shredded beetroot had become a staple in her daily lunch. Once it was reduced and replaced with easier-to-digest cooked vegetables, her symptoms resolved within days. For seniors, cooked beetroot in moderate quantities is generally better tolerated than raw beetroot or juice. Gradual introduction is key. If symptoms develop, reducing quantity or spacing out consumption across the week often resolves the issue. 3. Blood pressure imbalances. Not always a benefit. Beetroot is often recommended for its high nitrate content, which the body converts into nitric oxide. This compound relaxes blood vessels, promoting vasodilation and improves circulation. While this is beneficial for individuals with hypertension, it can pose a hidden risk for seniors already on medication to control blood pressure. The combined effect of beetroot and prescription medication can cause blood pressure to drop too low, leading to lightheadedness, fatigue, or even fainting. For those with a history of orthostatic hypotension, a common condition in older adults where blood pressure drops suddenly upon standing, this effect can be particularly hazardous. According to the Centers for Disease Control and Prevention, CDC, 1 in 4 adults over the age of 65 falls each year, and low blood pressure is a major contributor to these incidents. Even mild dizziness can have serious consequences for seniors, including fractures and loss of independence. In my practice, I've worked with several older adults who began beetroot juice regimens, hoping to lower their blood pressure naturally. In one case, a 79-year-old man fainted while gardening after consuming beetroot juice on an empty stomach. He was already taking 2 antihypertensive medications and had not been warned of the cumulative effect. Seniors considering beetroot for blood pressure support must monitor their levels regularly and consult with a physician. It's not about eliminating beetroot, but about understanding its powerful effects and managing intake carefully. 4. Kidney stone formation. A silent threat, beetroot contains high levels of oxalates, naturally occurring compounds that can contribute to the formation of kidney stones. While this risk may seem minimal, it becomes more relevant in aging populations who often experience declining kidney function. Calcium oxalate stones are the most common type of kidney stones, and beetroot is among the top foods known to increase urinary oxalate levels. Seniors who are predisposed to kidney stones, have a family history, or take calcium supplements are especially vulnerable. A comprehensive study by the National Kidney Foundation found that the prevalence of kidney stones increases significantly with age, particularly in men over 60. Once developed stones can lead to intense pain infections and potential hospitalizations events that are far more complicated for elderly patients to recover from. If you or someone you care for has a history of kidney stones, it's best to consume beetroot in limited portions, preferably not more than once or twice a week. Pairing beetroot with calcium-rich foods such as cheese or yogurt can help bind oxalates in the digestive tract and reduce absorption. Drinking plenty of water is also essential to dilute oxalates and support kidney function. 5. Blood sugar surges, a hidden risk for diabetics. Despite its earthy, slightly bitter flavor, beetroot is deceptively high in natural sugars. In juice form, especially beetroot delivers a concentrated dose of glucose that can spike blood sugar levels, rapidly posing challenges for individuals managing type 2 diabetes or prediabetes. As people age, insulin sensitivity often declines. According to the American Diabetes Association, nearly 25% of adults over 65 have diabetes, with many more living with undiagnosed or borderline blood sugar issues. Adding beetroot to the diet without considering its sugar content can destabilize blood sugar control and lead to fatigue, increased thirst, or long-term complications. In one real-life case, a 76-year-old diabetic woman began drinking beetroot juice each morning after reading about its cardiovascular benefits. Within 2 weeks, her fasting blood glucose had jumped by over 30 points. It wasn't until a routine check-in with her care team that the connection was identified. To enjoy beetroot without risking glucose spikes, seniors should consume it alongside sources of protein and fat such as eggs, nuts, or legumes. These macronutrients slow the release of sugars into the bloodstream and offer better glycemic control. 6. Allergic reactions. Rare but not to be ignored. While uncommon allergic reactions to beetroot can and do occur, particularly in individuals with sensitivities to certain plant-based compounds, these reactions may range from mild symptoms, such as itching hives or skin redness, to more serious manifestations like facial swelling, tightness in the chest, or difficulty breathing. In older adults with pre-existing respiratory conditions or weakened immune responses, what starts as a minor irritation can quickly escalate into a dangerous situation. Older skin is typically thinner and more sensitive, and age-related changes in the immune system can make seniors more vulnerable to allergens. A phenomenon known as immunosenescence, the natural aging of the immune system, reduces the body's ability to regulate inflammatory responses, increasing the risk of exaggerated allergic reactions. One 81-year-old patient I worked with experienced sudden swelling and an itchy rash after consuming a roasted beetroot side dish at a holiday gathering. She had never had any known allergies to food, and the reaction came as a complete surprise. Emergency care was required, and follow-up testing confirmed a sensitivity to betalains, the pigments found in beetroot. It was a clear reminder that new food sensitivities can develop later in life, even with foods that seem benign. For seniors trying beetroot for the first time, it's wise to begin with a small portion and monitor for any skin, respiratory, or gastrointestinal changes. If any symptoms arise, stop consumption immediately and consult a healthcare provider. Keeping antihistamines on hand as a precaution can also provide peace of mind. 7. Mineral overload. When nutrient-rich crosses the line, beetroot is often lauded for its impressive mineral profile, including iron, copper, magnesium, manganese, and phosphorus. While these are essential to good health, excessive intake, especially through juices or supplements, can lead to the accumulation of certain minerals in the body, triggering imbalances or even toxicity over time. One of the greatest concerns is iron overload or hemochromatosis, a condition where the body stores too much iron. This can result in fatigue, joint pain, irregular heart rhythms, and liver damage. Though rare, the condition becomes more prevalent with age, particularly in those with a genetic predisposition or impaired liver function. Women are generally less at risk before menopause due to menstrual blood loss, but this protection diminishes post-menopause, making senior women equally susceptible. Copper, too, can be problematic in excess. It plays a key role in neurological function, but elevated levels have been linked to cognitive decline and increased risk of Alzheimer's disease in older adults. One documented case involved a 70-year-old man who had been juicing beets daily as part of a detox protocol. Blood work later revealed excessive ferritin levels, a marker of iron overload, and early signs of liver stress. Once the beetroot juice was removed from his regimen and dietary intake was adjusted, his levels stabilized. The solution here is not to eliminate beetroot entirely, but to treat it with the same respect and moderation we afford any supplement or high-impact dietary choice. Seniors, especially those taking multivitamins or mineral supplements, should track their nutrient intake with the help of a nutritionist or physician. Periodic blood tests to monitor mineral levels are a wise precaution. Conclusion: beetroot is without question a food with remarkable health-promoting properties. From improving blood circulation to supplying a rich array of antioxidants, it can be a valuable part of a balanced diet. However, like many superfoods, it carries risks that are too often overlooked, especially when it comes to vulnerable populations like older adults. In the context of senior health, every dietary decision matters more. The aging body is more sensitive to excess, less adaptable to change, and often working in coordination with multiple medications. A seemingly innocent food like beetroot can interact with medications, aggravate underlying conditions, or create confusion with symptoms that mimic more serious illnesses. What can we learn from this first context is everything. A food that's good for the average adult may be inappropriate or even dangerous for someone over 70 with chronic conditions or multiple prescriptions. Second, personalization is essential and is. No two seniors are alike, and dietary decisions must reflect the unique medical history, nutritional needs, and sensitivities of the individual. Third, moderation and monitoring go hand in hand. Beetroot doesn't have to be eliminated from your diet, but it should be introduced carefully, eaten in sensible amounts, and watch for side effects. Whether you're sipping juice, roasting slices, or adding it to a salad, remember that more is not always better. And finally, education is power. The more you know about the foods you consume, the better you can protect your long-term health and avoid surprises that could compromise your quality of life. Incorporating beetroot into your diet doesn't have to be risky, but it does need to be intentional. Speak with your healthcare provider, especially if you have existing health conditions, and base your decisions on science, not hype. The goal isn't to fear food, but to use it wisely with the wisdom and experience that only comes with age. If you found this article helpful, insightful, or thought-provoking, please take a moment to support our mission by subscribing to the Longevity Secret channel. We're dedicated to helping you live a healthier, longer life by sharing expert-backed information designed for seniors and caregivers. Don't forget to like this video, share it with your loved ones, and turn on notifications so you never miss the guidance that could make all the difference in your health journey. Thank you for reading, and remember, the best investment you can make is in your well-being.